I'm Faith. I'm a Health Justice Partnership lawyer based out at CoHealth. CoHealth's a community health organisation. I work with various teams there who specialise in helping older clients. One of those clients is an older woman. She was experiencing family violence, which was perpetrated by her husband, who was also her carer. Because of the violence, she found it very difficult to attend appointments, and if she could attend, he would insist on being with her. During one of her physio appointments, he was actually in the waiting room, but her physio identified that she actually had a legal issue and recommended speaking to me. The client was happy with this, but she didn't want her husband to know about her speaking to a lawyer. So I actually arranged to come and meet with her during her next physio appointment, and her husband wasn't there because he was in the room. During the appointment, I was actually able to find out a bit more about her life story. She was a very independent person, naturally. She was the main breadwinner. She'd supported her family for quite a while, but the last couple of years she had a lot of health problems and she became more dependent on her husband. But by speaking to her without her husband knowing, we're able to firstly make sure she was safe, but then it also meant that she could be empowered to make decisions about her future. And that really sits nicely with what we're trying to achieve at Seniors Law by allowing people to age with dignity and respect. And I think one of the advantages of a health justice partnership is that we're able to speak to clients and help them where we otherwise wouldn't be able to.
So Justice Connect Seniors Law team has been working with older people for 6 years, and what we have learned is that if we were to actually position ourselves and put a lawyer in either a hospital care setting or a healthcare setting, we are likely to see vulnerable older people and be able to provide them with legal advice. One question: what do we know about older people? We know that they are more likely to recognise a healthcare issue and go and see their doctor than they are a legal one. And unfortunately, our experience has demonstrated that by the time an older person recognises a legal issue, it is often too late. So if we can get in terms of the early intervention, then we're going to get a better outcome. We've been piloting it for a period of 3 to 4 months. We have great early indicators of success, and we would love to be able to pilot this in New South Wales so that we can reach vulnerable older people who are at risk of or experiencing elder abuse.